Absent. SIBILIYA KARUPAM. I think she can start. Yeah, you start. Prevalence of visual impairment and pattern of ocular morbidity in geriatric ward patients. Yes. 5 minutes. Huh?
Good morning to all. Today I'll be presenting my paper on the topic Prevalence of Visual Impairment and Pattern of Ocular Morbidity in Geriatric Ward Patients. These are the table of contents. So why we conducted such a study? As we all know, elderly people are a valuable resource for any society. But aging is a natural phenomenon with opportunities and challenges. Visual impairment and blindness are strongly associated with aging and late life disability. So our aim was to estimate the prevalence of visual impairment and pattern of ocular morbidity in geriatric ward patients. So a hospital-based cross-sectional study was conducted in the Department of Geriatrics in a tertiary care hospital. 144 eyes of 72 patients were examined, and after taking a detailed history, the visual acuity, anterior segment examination, intraocular pressure, dry eye evaluation, and dilated fundus examination was conducted. 58 subjects were fully cooperative for the complete ocular examination, and all data were statistically analyzed, and a p-value of less than 0.05 were considered to be statistically significant. And based on the visual acuity, visual impairment was categorized into mild, moderate, severe, and blindness categories. And our results were 41.7% were belonging to an age category of 61 to 70, and majority of them were females. 48.6% were having a primary level of education, whereas more than 30% of the people more than 30% of the subjects were having one or more of the comorbidities. More than half, that is 52.8% of them had not undergone any ocular examination in the past 3 years, and 45.8% were previously involved in an occupation. 43.1% were visited by their relatives once in 3 months. And apart from cataract, these were the other ocular findings which we could see, that is around 73.6% were having tessellated fundus, 51.4% having dry eye, 30.6% having ARMD, and 23.6% having diabetic retinopathy. And we found that prevalence of visual impairment was 79.97%, of them being 41.8% having a moderate level of visual impairment. And cataract was found to be the most common cause of visual impairment in all the categories. The second common cause was found to be age-related macular degeneration in mild, severe visual impairment and in the blindness category of visual impairment. And diabetic retinopathy was found to be the second common cause in moderate visual impairment category. Age had a statistically significant positive correlation with visual impairment. Grade of visual impairment was also higher in more than 70 years of age group. There was a negative correlation between the education status and occupational status with visual impairment, even though the difference was not statistically significant. Visual impairment was found to be less in those having diabetes mellitus and hypertension, but that was not also statistically significant. Coming to the discussion part, in our study, the prevalence of visual impairment was 79.97%, and 41.8% was having moderate visual impairment. In the study by Srinivas et al., visual impairment was found to be 30.1%, and 23.6% had moderate visual impairment. 43.7% had visual impairment in the study conducted by Mahesh Kumar Dev et al. And in all these studies mentioned above, including our study, cataract was a major causative factor for visual impairment. More than half of the subjects in our study had not undergone any ocular examination in the past 3 years. Study by Mahesh Kumar Dev et al. Found that about 35% of the residents had no history of eye examination during their lifetime. Study by Srinivas et al. Found that compared to those with no formal education, those with school education or higher education had a lower odds of visual impairment, which was similar to our study. In the study of Srinivas et al., those reported to have diabetes and hypertension had lower odds of visual impairment, which was similar to our study. Prevalence of dry eye disease and diabetic retinopathy was less compared to our study, and prevalence of ARMD was more in our study compared to the study of Vipa, Florence et al. So to conclude, prevalence of visual impairment was 79.97%, with majority being in the moderate category of visual impairment, and cataract was the most common cause of visual impairment in all these categories. ARMD and diabetic retinopathy was the second common cause. To suggest implementing routine ocular examination in geriatric ward patients and old age homes can help in providing appropriate intervention and treatment at the earliest. Mobile ophthalmology unit and teleophthalmology extending to these subjects can also provide eye care available to the elderly. Educating elderly people and their caregivers can also help in preventing ocular morbidity. Here are my references. Thank you.
Very nice paper, like something relevant in the geriatric population. How will you categorize the visual impairment? How did you categorize the visual impairment as per which criteria?
By ICD 11 criteria, it was categorized based on the visual acuity into mild, moderate, severe, and blindness category. If it is more than,
No, any patient had a glaucoma?
yes, ma'am. But it was only around 2.8%, so it was not
How did you diagnose glaucoma?
based on the intraocular pressure and fundus examination, optic nerve changes. But field was not taken, ma'am.
What was the, like these patients were all in old age homes or in a hospital?
In a hospital, ma'am. In our hospital, 72 patients were there.
So they had come for multiple other causes. Or they had come to ophthalmology or they were admitted for some other diseases?
Actually, they are like a neglected group of people that have been admitted in our in the geriatric.
So they're
ward as
almost
well.
like it's almost like a care home, isn't it?
Yes,
So
ma'am.
your population is not in the typical, it's a special kind of population,
So
isn't it? And what is your, what is the criteria for putting them in geriatric age group? Did you have any age criteria?
we took all the patients, ma'am. All the 72 patients were there.
What
in
was the age criteria above which you categorize them as
geriatric?
geriatric?
Yeah, that was 60, above 60 will be in the geriatric group. But here, all the patients were taken, madam. But yeah.
Okay. So there could be a lot of confounding factors. What you said, had multiple systemic disorders. Did you look at that, whether they were related to their visual impairment?
Yes,
You
ma'am.
said you couldn't find any statistical association.
But diabetes and hypertension, those having diabetes and hypertension were found to be having less visual impairment.
Which is contrary to the
Yeah, but
belief.
this was also found in other studies also, madam.
The study by Srinivas et al., what was the population?
Around 800.
No. Did they do a community-based study, or did they go out into the any particular geriatric home and did it?
Age homes they went.
Okay. So I think, and your your classification of diseases is very varied. It should be more specific. Like you have put Rho plus positivity, Rho plus, all those things as your disease classification. You can probably narrow it down to specific diseases. See, it's expected that with age, your visual impairment increases. What you should try to find out from your study is that in this group of neglected elderly population, is there prevalence of any particular disorder which is more than the group which is having probably a normal community, normal social life? You understand? So normal population, elderly population also have a lot of visual impairment. So in this group of neglected elderly patients, are they having any specific visual impairment? Are there any challenges for them to get care? So those are the things that you should highlight.
All right, ma'am.
Because it is normal that as age increases, visual impairment will happen. Cataract is the most common cause. What you should try to highlight in your study is that, is there any difference in the pattern of visual impairment in this group of neglected elderly population? Are there any challenges for them getting eye care? And if so, what can we do to improve? That should be the thing that you should highlight. Because everybody knows cataract is the most common cause of visual impairment in elderly population. You understand? So that you have to make your paper novel in such a way that it has to be noticed. Otherwise, it just becomes like any survey. So your paper should stand out different from a survey when you pick out a novel feature.
All right, ma'am.
Okay, so that would be the thing that I would expect you to work on it.
Madam,
All the best.
Should it be like a comparative study by taking both these subjects?
You have to look at the statistics of a general aging population. It again, cataract will be the highest in them. You compare it with this and see whether there's any difference in the morbidities, ocular morbidity, or if so, what are the challenges which prevent them from accessing healthcare, and any other diseases